Hello friends, today I'm presenting my first video on the advice and the recommendations of all my patients in the Middle East. This is DR.ABHAY Verma. I am welcoming you all on my channel, the ultimate DR.ABHAY Verma, as it is called, because I am indeed the last doctor you will ever meet for all the chronic diseases which lead to impairment of not just one organ but polyorganic impairment. Today is the 4th of May 2023. Today we are going to talk about diabetes. Sugar diabetes, that is called in Russia sakharny diabetes, or the sugar diabetes, or in Hindi just diabetes. So they ask me my history, where I'm from. I'm from India, but I'm a practicing surgeon in laparoscopy and abdominal surgery in St. Petersburg, Russia. And I also practice in New Delhi, India. So, and having other qualifications as well. But as I have been undergoing my training all these times, I found that a lot of chronic diseases like liver cirrhosis, ulcerative colitis, alcoholic liver disease, diabetes, sugar diabetes, idiopathic thrombopenic furfura, and other chronic diseases like renal impairment and everywhere. Do they have a cure? The point is, do they have a cure, or the patient needs to only undertake liver transplantation, for example, for liver impairment, or keep swallowing tablets all his life for diabetes, for example, or maybe in any other, for example, renal transplant. Is it possible to evade all these diseases? So I really did understand that it is very much possible. So today I'm going to talk about diabetes. Let's come to the topic, as the video should not be very, very long. And as per a lot of people from Saudi Arabia, from the United Arab Emirates, Dubai, Abu Dhabi, Bahrain, Manama, Al Riyadh, Dammam, Azerbaijan, Turkey, Istanbul, Ankara, they have been calling me and saying, sir, please give us something in English regarding because we don't understand Russian all the time, as I have another channel in Russian where I undertake all the basically people who don't speak English. But today I'm speaking for all the people over here in Dubai, in UAE. So do we have a cure for diabetes, or do you have to undertake all the tablets whole life? Or is it possible to avoid diabetic retinopathy? I want to explain the terms now. Retinopathy, that leads to blindness, and diabetic nephropathy, that leads to impairment of the kidneys, and vascular diabetic diseases, and anaerobic infections, where people get amputations starting from the foot, then going above and above and above to the knee, and sometimes the whole of the leg, the arms. So can we reverse it? The fact is yes. The fact is yes. Yes, yes, and yes. Because I have a combined therapy for the patients, and the maximum time duration, I'll tell you, it's from 4 to 6 months. The diabetes will be cured from its root level. May it be type 1 diabetes, autoimmune diabetes, which takes a little longer, that is insulin dependent. And the type 2 diabetes is also diabetes mellitus. That's also 99% curable. I won't say 100%. Even the management is very much possible. If patient says, I cannot live without, I have to undertake. If the situation is very, very, very bad for the patient, then we can at least manage it to the level that he needs no amputation. Even the gangrene infection, it tends to lower down Clostridium perfringens infection, and anaerobial infections, other infections, they tend to go down. No need of any steroids, no need of any tablets the whole life. I won't be saying whatever it is, but the basic, what is the end result? The end result of the diabetes is, if anybody knows or he doesn't know, that is the basic HbA1c. HbA1c is a special hemoglobin that is produced, and it should be less than 5.8 or 5.2. Random blood test, not the fasting blood test. That is the basic thing. And the LDL, low density lipids, and VLDLs, they should be under control. The cholesterol should come under control. And as for the kidneys, the creatinine levels, automatically they go down. They go down. Yes, that is the basic thing. The drugs, people which in allopathy, the people take. I have a combined treatment. It's not just allopathy, the Western system. It's the Indian system. It's the Chinese system. It's the German system, homeopathy. Everything is included. For example, in India, I have the right to prescribe all these medicines together as a doctor. I have a license over there. But in Russia, for example, I hold like a recommendation, because the Ministry of Health in Russia does not allow any other medicines other than the allopathic medicines, of whom the license, I am an allopathic doctor as such. This is all the things. So basically coming to the thing that can we fully treat the patient with diabetic retinopathy, arterial disease, infarct. These are the basic complications of the diabetes. Infarct of the heart, claudation of the arteries. Drugs, they tend to take steroids, thiazides, and basically they come from what the diabetes as a whole. In cystic fibrosis, you have diabetes. Pancreatic cancer, you tend to have diabetes. And endocrine dysfunctions, the Cushing syndrome. Can it be controlled? Yes, it can be controlled. Acromegalia, it can be controlled. Yes, it can be controlled. Pheochromocytoma, can it be controlled with diabetes? Yes, of course, yes. Thyrotoxicosis, that's thyroid. I forgot to say. It will also be cured and brought under full control, because it is not just the pancreas that I am treating. We are treating the whole structure as together. The glucose, the random glucose should be less than 7. Random, I am not saying the fasting glucose. It will come down around time duration 4 to 6 months. The patient needs to have a special diet, and the medicines which are prepared specially for each and every patient individually. I don't have any magical pill or a magical capsule which I can provide for all the patients altogether. That's really not possible. I tend to, each and every individual is counted as per his situation or her situation to the best. Even I have patients with insulin resistance. There's insulin resistance. Can it be cured? Yes, it can be controlled. Obesity in pregnancy, basically people of Asian origin are the ones who have the most of the diabetes, which I have seen. Even in America, all my patients who are there, they are of Asian origin mostly, and the Mexican origins. Yes. So these are the basic diseases, and people who had suffered from, for example, renal impairment, they had been taking medicines. Isoniazid. From tuberculosis, they had been taking treatment. Antibiotics, rifampicin, for example, overdose causes diabetes. Yes, it does. So we undertake all these things together. Urinary tract infections, polyuria, for example, these are not liver or kidney impairments, they're all controlled in this treatment. What do we basically need? That is a full control of the vascular diseases, and basically the retinal, what is called diabetic retinopathy. Of course, yes. diabetic retinopathy. It leads to blindness. Can it be controlled? The sugar be controlled. Every time the patient comes, it goes through the doctor for an injection, which is a steroid infection, to temporarily restore his vision. Temporarily restore his vision. After some time, it is again repeated. 5 years, 7 years, 8 years, 35,000 Indian rupees they take in India. I know the hospital in Delhi, and it's the same story going on. They are not being treated. So over here, you get a full treatment for diabetes, type 1 and type 2. Insulin dependence is gone in due course, is reduced, slowly reduced, slowly reduced, slowly reduced, and in the end, it will come to zero. I can very well say this thing, it will come to zero. So all the patients who are having diabetes right now, sugar diabetes, please call me on my WhatsApp number, leave your analysis. The maximum time duration is 4 to 6 months. Maximum 4 to 6 months. The first results are already seen in around a month or 2 months. You can give your blood and you will see it starts falling. And overall the status starts improving. So a very short video for the first time. What are the medicines I use? I told you there are the allopathic medicines, whatever you are taking. Plus allopathic medicines, we are having glyconiazides, metformin, and all other medicines, abricose, acarbinose, everything is there. Plus we have the Indian medicines from the Indian Ayurveda, plus I have medicines from homeopathy, the general medicine system. Plus we engage in medicines from the Chinese medicine, the Tibetan medicines. They are very strong medicines. They are really indeed medicines. That's the basic thing. Not all doctors have this, I will say, they know the purpose only by the book. But the book theory is not going to help here. We need to be practical, sir. That's my basic point. Whoever liked this video, please don't forget to subscribe it as an improving my channel. And please do like the video as it goes forward. And please share it in your groups with your people who are suffering from diabetes. Nobody is going to die. Patients, young patients as 45, 48 years old, they're having heart attacks and dying from diabetes. Diabetes is out of control. Everybody says you have liver renal impairment, go for transplant. But that transplant will not work until the diabetes is controlled. The sugar levels are controlled. That's the basic thing. Okay, thank you so much for this video, and hope to see you soon for a next video on liver diseases. Thank you very much.